This PowerPoint discusses the roles and characteristics of the care manager. First off, what is the difference between a care manager and a case manager? From what I understand, case management is just one aspect of care management. Care management is a system that includes collaboration or care coordination and case management. Its purpose is to reduce hospital use and ER visits. Case management is the act of assessing patient needs, creating a plan of care, coordinating with necessary disciplines, and advocating for the patient in an attempt to promote high quality and low-cost healthcare and to improve patient outcomes. This is typically done by a case manager who is a nurse, social worker, or other healthcare professional. Care managers work in a variety of settings. These include, but are not limited to, hospitals, transitional care and rehab facilities, long-term care, skilled nursing facilities and assisted living, outpatient clinics, student clinics, hospice and home health companies, and disease management clinics. Their role is vital to the healthcare industry. Care managers create personalized patient care and establish effective communication across multiple disciplines. They do this to improve patient outcomes and to decrease the use of unnecessary hospital and doctor visits. Healthcare in the U.S. is the most costly in the entire world, according to the Institute of Healthcare Improvement. For this reason, the role of care manager has been created to help improve the healthcare system in three vital aspects: patient satisfaction, overall population health, and reducing the cost for the patient. Care managers do this by ensuring patients receive the proper care they need from multiple disciplines, decreasing their risk for rehospitalization and further complications, thus decreasing costs, increasing patient satisfaction, and improving the health of the population in which they work in. Care managers ensure follow-up visits are scheduled, necessary medical equipment is provided, paperwork is taken care of, and that the patient is referred to specialists, home health care, etc. In all of these ways, we can improve all 3 points of the triple aim developed by the Institute for Healthcare Improvement. I've already mentioned several of the care managers' roles and responsibilities. Care managers educate their patients and their family members. They advocate for the needs of the patient, including financial needs. They coordinate proper care through screenings and assessments, planning care, and communicating with patients and healthcare providers. Care managers follow up with patients to ensure they are complying with their plan of care. They make sure any post-acute needs are taken care of in order to reduce the risk of rehospitalization, and that patients are transitioning appropriately. Care managers also communicate with insurance payers for authorizations and provide timely notification and communication with them. They document appropriately so that there are no delays or denials in payment. So as you can see, the role of care manager is vital to our healthcare system and to the success of our patients.